Hi, the other day a patient came to my OPD who did not know how to do the urine pregnancy test, that too without a disposable cup. So, to actually do a urine pregnancy test, all you need is a UPT kit which has a dropper, a test kit, a desiccant to prevent it from moisture, and the magical packet of the kit which is a leak proof container in itself. All you have to do is collect the urine or your pee in the packet and with the help of a dropper, put 3 to 4 drops of urine in the small circular hole in the kit. Now, it's a waiting game and you have to wait for the result. The T in the test kit is actually going to denote your test result. The C is the control, or basically the color match with which you check your test result with. A dark line at T and a dark line at C is suggestive of a positive urine test. The negative test will not have any line at T, will only have a dark line at control. Sometimes the test kit may show a faint positive line at T and a dark line at C. This could be due to low hormone levels, which could be in a very early pregnancy or an ectopic pregnancy, in which the pregnancy is implanted outside of uterus, or due to a negative test which has been left out for a very long time. So you must read your test results within minutes of performing the test. Sometimes you may see that even after putting the sample, there is no line either at C or T. It means that the kit is faulty and you need to repeat the test with a fresh kit.